A 72-year-old man walks out of his doctor's office with a treatment recommendation that would have been different 6 months ago. Same doctor, same condition, different answer. Between visits, his doctor's organization started getting paid based on what it cost to treat him. The cheaper option just became the preferred option. That was not part of the conversation. Well, 3 months later, a specialist referral he expected never came. His doctor recommended monitoring. Instead of the procedure his previous care pattern would have triggered. The recommendation may have been sound medicine, or it may have saved the organization money. He has no way to know which, and that is the problem. So he's one of the 14.3 million Medicare beneficiaries inside a system most of them have never heard of. It's called the Accountable Care Organization, an ACO. So CMS, the Centers of Medicare and Medicaid Services, published a report in February 2026. You are more likely to be in one right now than at any point since the program started in 2012. Well, here's what that means for your care. An ACO takes the doctors, hospitals, and specialists involved in your care and group them into coordinated organization. Your cardiologist can see what your endocrinologist prescribed. Your lab results reach your primary care doctor before your appointment instead of after. When it works, that's better medicine. And it does work. The ACO saved Medicare $2.5 billion in 2024. That same CMS report shows ACOs themselves earn $4.1 billion in shared savings. Well, that's not a small pilot program. It's a direction Medicare is moving, up to 4.4% from last year. So far, this sounds like good news, and it can be. But here is what is missing from the conversation. That organization has a direct financial stake in what happens to you. If your health outcomes improve and costs stay below a benchmark, the ACO shares in the saving. If costs go up, they share in the losses. So you see, 82.8% of ACOs are now in performance-based risk tracks, the highest since the program began. Your outcomes are their bottom line. And this is accelerating. The system is tightening around you. 3 years ago, your doctor's organization might have operated outside this financial pressure. But today, 82% or 82.8% of them are inside it. The window where your care existed outside a financial incentive structure is closing. For most Medicare beneficiaries, it has already closed. Well, think about what that means the next time your doctor recommends a treatment. The question is not whether your doctor wants the best for you. Well, most do. The question is whether the system your doctor works inside creates pressure that shapes what the best looks like. When spending less on your care is rewarded, every recommendation passes through a financial filter, and that filter is not part of the conversation. And increasingly, AI is part of how those decisions get made. Prior authorizations, the step where your insurer decides whether to cover a procedure before your doctor even performs it. Algorithms are processing that decision. Diagnostic imaging, the scans that your doctor orders, AI tools may have flagged what the radiologist looked at first. Treatment recommendations shaped by algorithms that compare what your care costs to what the system expected it to cost. And here's what makes it invisible. Nothing changes on your end. You see the same doctor. You go to the same office. Your appointment looks exactly the same. But behind the appointment, the financial structure has shifted. The organization coordinating your care is now measured and paid based on what it costs to treat you. So you walk into your last appointment trusting the system. Behind the screen, decisions were already being made inside the structure that had not entered the conversation. So in our previous episode, we showed you how the government documented that AI systems can fail catastrophically on patients they were not trained for, particularly for older adults with complex medical histories. And we showed you how the clinical guidelines those AI systems learn were shaped by the companies that profit from them. Well, that failure and that bias do not happen in a vacuum. They happen inside the system. Inside the ACO, where spending less on you is a financial incentive. So now here is a question that changes everything. If an algorithm inside your ACO processes a recommendation about your care, and that recommendation happens to save the organization money, how do you tell the difference between good medicine and cost cutting? Well, right now, you cannot, not without asking. So who is watching this? Well, more agencies than you might think. The Federal Trade Commission, the FTC, the Department of Justice, the Consumer Financial Protection Bureau, and the Equal Employment Opportunity Commission. 4 federal agencies issued a joint statement in April 2023. They pledged to enforce anti-discrimination laws against algorithmic bias in automated systems. That includes systems that correlate data with protected characteristics, including age. In plain language, if a computer system treats you differently because of your age, these agencies say that's illegal. Well, in February 2026, the FTC opened a formal investigation into AI products aimed at vulnerable populations. Their words, the Commission's interest in protecting consumers at its apex when those consumers are the elderly. Translation. When someone is going after older adults, the FTC pays the most attention. And Congress put money behind it. The Consolidated Appropriations Act of 2026 allocated $941 million for healthcare fraud and abuse control. Well, that's the government's budget for catching systems that cheat you. $35 million of that goes specifically to the Senior Medicare Patrol Program. This is a program built to help you spot and report when the system is not playing straight, including the algorithmic kind. 4 agencies, nearly $1 billion allocated, age specifically named as a protected class. Well, remember the number, 14.3 million people inside a system with a financial stake in their outcome. 4 agencies watching, nearly $1 billion allocated. And still, how would you even know if an algorithm discriminated against you? You can't see the algorithm's output. You only see the results. A denied procedure, a different treatment recommendation, a scan that comes back normal. You have no way to know whether that outcome came from good medicine or from a system optimized to save money on patients like you and I. Well, that's why the questions matter more than the enforcement. The agencies can investigate patterns across millions of patterns, but your individual experience, whether the treatment you were recommended was your best option for you or the cheapest option for them, well, that's something only you can surface by asking. Enforcement is reactive. The FTC investigates after harm occurs. The DOJ acts after patterns emerge. The government has a framework that defines what you deserve to know about AI decisions. The NIST explainability framework, published by the National Institute of Standards and Technology, it's 130 pages. It's best practice guide, not binding law, at least not yet. The regulators are watching the system, but they're not in the room when the algorithm processes your data. You are. And that means the question have to come from you. So here's what you do. 3 questions tell you whether you are inside the system and how it works. Am I in an ACO? Does my provider's organization share in savings or losses based on my health outcome? How are the treatment decisions coordinated across my care team, and is AI involved? If you are on Medicare, there's a good chance the answer to the first question is yes. 14.3 million people, up 4.4% in 1 year. And most of them have no idea. And now, 2 questions that go deeper. So in the previous episode, we gave you 4 questions from the government's explainability framework: rationale, responsibility, safety, impact. If you missed that episode, those 4 questions are linked in the description. Those 4 tell you what the system decided and who is accountable. But there are 2 questions that we did not cover last time. And inside an ACO, they may be the most important ones you ask. Data. What data about me was used in this decision? And what data was the system originally trained on? You see, inside an ACO, your data is being shared across providers. It's being processed by algorithms coordinating your care. You have the right to know what's feeding those decisions and whether the system was trained on patients who look like you, who take the medications you take, and carry the history your body carries. Fairness. Were patients like me represented in the training data, my age, my conditions, my demographics? Well, a system that is 99% accurate overall can miss 1 in 5 patients like you. Inside an ACO where financial incentives are tied to your outcome, that accuracy gap has a dollar value, and the cost lands on you. 5 things you can do this week. 1, ask those 3 ACO questions at your next appointment. Write them down, pen or paper. Hand them to your doctor. You do not need to explain why you're asking. The fact that you're asking is enough. 2, ask the data and fairness questions anytime an algorithm is part of the medical decisions about you. You don't need permission. You do not need a medical degree. None of these require anyone's approval. They're yours. Well, here's 3 more. 3rd one, contact a senior medical patrol program. They exist specifically to help you identify and report healthcare fraud and abuse, including the algorithmic kind. $35 million in federal funding says this is not theoretical. It's a program the government built for you. And 4, file a complaint with the Federal Trade Commission if any AI tool involved in your care cannot explain how it reached its conclusion about you. The FTC is watching. They named you as the population they're watching hardest. You don't need a lawyer. You need a compliant and specific experience. And 5, if you cannot access your Medicare information in an accessible format, file a 508 complaint to CMS. Section 508 is a federal law that requires government information to be accessible to everyone, including people with disabilities. The complaint process is online or by mail to the Office of Civil Rights at the Department of Health and Human Services. 5 actions, all of them yours. None of them require a law to pass first. So let me bring this home. The man who walked out of his doctor's office with a different answer than he would have gotten 6 months ago? Well, the one whose specialist referral never came? The financial structure underneath his care had changed. Algorithms were part of how decisions reached his chart. None of that had entered the conversation. He did not have 3 questions to find out. He did not have 2 questions to go deeper. And he did not have 5 moves to protect him. He's watching this right now, and now he does. So you've been navigating this system for years. Well, you've been making decisions inside a financial structure that has not been part of the conversation. Well, that changes now. 14.3 million Medicare beneficiaries are inside a system that saved $2.5 billion last year. Well, that's real money, real coordination, real results. But the same system that coordinates your care has a financial stake in what care costs. AI is embedded in the decision-making layer. And until right now, none of it was on the table. Now you know the system exists. You know who is watching. You know what to ask. And you know exactly where to go when the answers are not good enough. The ACOs are not your enemy. When coordination means your doctors actually talk to each other, That's the best thing that can happen to your care. The question is whether you are getting coordination or cost cutting. So now you have the questions that tell you which one. Your one move this week. Bring those 3 ACO questions to your next appointment. Pen and paper, hand them to your doctor. You do not need permission. You do not need a law to pass first. You need 3 questions and the willingness to ask them. The system was built to save money. Now you know how to make sure it does not save money on you. So if someone in your family is on Medicare or will be soon, send them this video. Not after the crisis, before it. Next, the AI tools that claim to help with brain health and cognitive decline. Which ones actually work? Which ones do not? And the one question that tells you everything before you download anything. Well, that's coming in the next video. Subscribe so you're here for it.